Okay, so just briefly about triaging. In triaging, you have three main choices. You can accept the referral, you can reject, or you can redirect. The first thing is accepting. I would recommend that you try to get a look at the notes first of all and be sure you read all the referral properly. You can look at the chart and see blood results if you need to, just to get a good idea for what's going on before you hit accept. To accept, click on accept, and then the GP will automatically receive a reply saying that has been accepted. However, you also need to book in the appointment. So that's called an APPT01, which you can type in manually, but there should also be a shortcut button on the triage form. You just click that there and then put in if it's routine or urgent, and then that's it, done. To reject it, you press.
I'll just pause there for a second. When you're accepting them, are you accepting them as your patient? Is that right?
No, you can do, but you when you accept, it's just telling the system I'm accepting this. Then you order the appointment. If you just want to put on to pediatrics, you would choose just pediatrics. Then, if you want to put onto a specific person's clinic, you can specify their clinic as well. So, if it's a patient known to you and you think, actually, I'm going to review them, you can do that there and then. But if you just want to put it onto the department routine waiting list, that's the default thing you would choose then.
Perfect. And then, if you wanted somebody else to make a decision about how and where to triage?
So what you would do then is send that person a message.
A consultant colleague?
Yeah. So send them a message. So that would be, if you go to search and type in message, you can send the staff message, which will include the patient's chart so they can see the details. And send them a message saying, can you please consider reviewing this patient, or whatever your message is. And then they can either book it in directly to their clinic or reply to you and that you do that work, and then that's it, done.
And tell us about the baton.
So any message
any triaged
in a pool will have a baton symbol beside it. The baton with a question mark means that nobody has taken responsibility. If it has a minus, that means somebody else has taken the responsibility, and if it has a plus, that means you have done it. So for triage, they go into your consultant lead clinician pool. So they're all pool messages. So they'll all have batons beside them. If you recognise the patient or you know you want to take responsibility to sort that one out, you can click on the baton symbol, sort it out, and then it will go away once the referral has been triaged.
And that's what referrers do. As if you're the triaging consultant for a week, you'll be looking at the generic messages about triage, and you will be managing most of them.
Yeah.
But for those that you think need to be triaged by somebody else, you will not touch them.
So what we would typically do is, say there are 20 referrals and 15 of them are straightforward, just accepting or rejecting. We just do that, they go away, no problem. If there is maybe one or two who we know belong to another consultant, or are GPs just sending in letters as further information, we can take the baton for that and forward that information to the relevant consultant and then let them decide what to do. The triage will stay in the in basket until it's dealt with, so you'll still have to come back and deal with it, either yourself or the other person you're messaging.
And to take the baton, do you click on something?
Click on the baton itself, yeah.
And it becomes negative?
It turns into a plus for you and a negative for everybody else.
Okay, thanks, Carl.